doctor.
We talk about knowing your numbers regularly on Hello Doctor, and we're referring to blood pressure, sugar and cholesterol. But if you find yourself in an emergency, there are more important numbers that would come in a whole lot handier, such as 084 124 will get you all of ER24's emergency services, and similarly 082 911. 10111 will get you the flying squad, and 10177 gets you the ambulance services, and 0800 333 444 is the Poison Management Center for when Junior swallows what he shouldn't. All important to know, but if you remember only one, let it be 112, an almost universal emergency number that works on any mobile phone, regardless of whether it's locked or even without a SIM card. 112. Don't forget it. If you want to have all those numbers, though, SMS the word Hello Doc to 33728 and we'll send them all to you straight away. That way I can sleep a whole lot better tonight knowing that you know your emergency numbers. Numbers that radio and TV personality Robert Marawa used a while back when he suffered a massive heart attack.
Robert Marawa has always had great instincts. When he left law school to pursue a career in television, his gut told him he was making the right decision. 15 years later, with a popular presence on radio and television, he's the country's leading sports anchor. His intuition paid off again some years later when Robert reacted swiftly to a bout of chest pain, saving his life by mere minutes.
Some call him Mr. Controversy, others say he's just a cowboy who shoots from the hip. Either way, Metro FM DJ and TV personality Robert Marawa cannot be faulted for his love and passion for sport. He also can't be faulted for a heart attack he got some years ago because he's not your typical risk factor candidate. Although he was a little stressed at the time. You must have been surprised at getting a heart attack, Rob.
No, I was, Michael. I think it's one of those things where I had decided to go back to gym after a long time of not actually exercising. You have been a fitness freak before, and then you kind of like lay it off, and then you go back to gym. So what my personal trainer basically did was just take me through the different steps and the different machines, because all of a sudden the machines have changed. But long story short, I know it had been hell of a long since it last happened, and got onto the machine. Did a couple of exercises, got out, just felt a very sharp pain in my chest. There was a cold sweat, went back home, very irritable. Then you want to remove your clothes, you want to sleep on the bed, you want to sleep on the floor. And then I just said, you know what, I need an ambulance. So a friend of mine called an ambulance for me, came through, went to the hospital. And after a couple of minutes, Doc puts his little machine there, looks at me in the eye and says, I'm sorry to tell you, you're having a heart attack as we speak. So you can imagine, I mean, as simple as that, straightforward into the operating room.
And you went white, no doubt, figuratively, of course.
Yeah, kind of.
Now, Celine, that's not typical. I mean, Rob doesn't have the typical risk factors for a heart attack.
Definitely,
so what do you
Michael.
attribute that to?
I think in Rob's case, it probably was the lifestyle that he was leading at that time, where we know that stress does play a big role in causing the final insult with a heart attack. There are a lot of other risk factors like smoking and hypertension, high cholesterol, diabetes, a family history. But I think we underestimate the role that stress plays in a heart attack, and Robert shows that clearly.
Sure.
You know, he's busy all the time, went back to gym after a long time, and the symptoms that he described are typical of a heart attack.
Okay.
The way you get the terrible crushing chest pain
like
with the
an elephant
sweat.
stepping on your chest.
Absolutely, yeah. It's a constricting kind of feeling that you get.
Okay, so you're on the table, you're having a heart attack. What next?
Well, the operation happens, and I've got no idea what to expect, because I'm sort of expecting an open heart surgery type of thing. You know, because I know very little about heart attacks. And then all of a sudden now they've got to work the groin area. So I'm thinking, what are they doing in the groin area now? They try and explain, but my mind is like all over. There's so many people there, someone's checking my pulse, and they're loading something into the drip, and you know, everything's just happening. You're under local anesthetic, so you can hear everything. So if the one's saying, hey, we don't have enough of this, somebody else is saying, Doc, we're losing him, you know. So all of these things are going on, and I'm thinking, oh, okay, well, today clearly is my last day on this earth. But yeah, they do an angiogram on me. Had no no idea what that is. Doctor explained it to me afterwards when he showed me the x-ray. Right. And he showed, you know, the artery having been blocked, and then after everything successfully went through, and then it was open again.
So Salim, just describe that treatment for us. An angiogram, a stent, opening up the artery.
But that's the best treatment for a heart attack. If you're having a heart attack, the best thing is to get to a hospital where you've got facilities to do that. And basically it's from the groin, local anesthetic. It's like when you go to the dentist, a local anesthetic.
In the groin?
And in the groin, yeah. And we put a little wire into the artery. We screen, and looking at the x-rays, manipulate this wire all the way up to the heart. And there's a little hole down the middle. We inject some dye through there. The dye flows in the arteries, and we can see where the problem is. Once we see where the artery is blocked, we put a little wire through that catheter that we have there. We open up the artery with a balloon, and then we put a stent into it. A stent is a stainless steel spring, and it helps to keep the artery open and prevents it from collapsing again. But you know, that's the emergency treatment. But the main thing with a heart attack is after that what happens. Right. Because the main thing is to prevent it happening again.
Yeah. And what are you doing to prevent that, Bob?
Well, I think a lot of things had to change. I had to look at my lifestyle. I had to look at my work schedule. The diet is very important as well, but also just to try and reduce your stress factor. You don't quite feel it at the time because you think you're doing normal stuff. You're flying all over the country, flying all over the world. You're eating junk food. You're not really in control of a lot of things. And those were the contributing factors for me. So I had to sit down with the people that employ me, and I said, listen, we need to change a few things here because I've come so close. In fact, estimated 23 minutes away from lights out. Wow. You know, so if you come that close, then you've got to change things, and if you don't, then there's a problem.
And do you live with that? I mean, day to day. I mean, do you get up in the mornings and think, I've actually had a heart attack? I mean, is that something that you consciously live with, or have you put that behind you and you said it's health from here on?
Well, I think I had to put it behind me because I know my family was very concerned. I mean, they even said, do you want to go for counseling? Do you want to go for some of those sessions so that you can deal with the trauma of what has happened? But, you know, I think as guys, again, you sort of typically say, you know what, it's fine. The shock of being told on that day was enough for me to really shock me for the rest of my life. So I don't want a constant reminder of it. But at the same time, I can also just work on overcoming that led to it happening at the time. So I've sort of let it go, but very aware, as difficult as it is within the industry, to try and maintain that strict regimen. Yeah.
This is a great testimony. And Salim, I mean, there are people watching here going, I do not want to get what Rob got. I mean, I'm his age, I'm 39, you know, let that not happen to me. How do we prevent heart attack?
I think the first thing is, don't think that it can't happen to me.
Yeah.
You know, that's the important thing. Heart attacks happen at any age. Robert's the prime example. So, you know, if you're leading that kind of lifestyle, you have to make a change. And the important thing is, for us, the strongest risk factor that we see is smoking. Right. And then high hypertension, high cholesterol. And if you're over 30, you need to have your cholesterol checked, because that's one of the most important things you can do to prevent that. You know, if you've got a family history, there's nothing you can do about that. But regular exercise, watching your diet, everything in moderation, that's what we preach. Yeah. So, you know, we treat the problem when it occurs, but the important thing is to try and prevent it from occurring.
Absolutely. Wise words, Salim. Thank you so much. Robin, thank you for sharing what you've shared, mate. We've got a couple of weeks to go before the World Cup rugby. What do you reckon? Are you going to have a heart attack if something doesn't win or someone doesn't win? And I'm going to, come on, boys!
Well, they're going to do something and they're going to go out there and win. You know, this trophy has never been defended ever in its history, so we need to do it basically for those reasons. A lot of criticism, but to prevent other things from happening health-wise, let them win it.
Well, I'm hoping for a hat-trick, in rugby terms, of course, not in terms of a triple bypass. That you do not want to get, as Rob so aptly pointed out.
BestMed Medical Scheme, at the heart of medical cover.